You called the meeting to order, right?
I'm going to.
Oh, okay.
Let's call this meeting of the Health and Human Services Committee to order. I trust all the members had an opportunity to read the minutes of the previous meeting. Anybody know any corrections that need to be made to those minutes? If not, they can stand as read, please. Okay, we have Steve Kiliansky, Chairman of the Veterans Service Committee here, please.
Okay, so we're doing a little bit of catch-up. Obviously, current events going on. Wasn't able to brief first quarter, second quarter, so we're kind of doing a little semi-annual brief. As you can see, the numbers pretty comparable to 2019 in terms of contacts and services. This time last year, I had about 650, and you can see there this year at the halfway point of the year, got about 474, excuse me. However, compared to last year in 2019, total amount of revenue into the county, federal revenue into the county was 359,000, and as of right now, we're sitting at about 407,000. So that's up close to 50,000 from last year at this point. And same thing with Medicaid savings. Last year at this point, we were at about 100,000 in Medicaid savings due to enrollments into VA healthcare and keeping them out of the Medicaid system. This year, at the halfway point, we're at 125,000. So although I haven't seen as many folks or had contact with many folks, because most of it's been over the phone, the numbers for Medicaid savings and for revenue into the county are up. Any questions on that?
Steve, when you said that the combined total back to the county of 407,000, does that mean back to the veterans of the county and
yes,
not the county government?
Correct.
Yeah.
Hopefully it'll all be spent in the county in some form or another. Some of the highlights at the bottom, the big one, and probably the biggest reason for the high revenue there, the 407,000, is because of the passing of the Blue Water Navy Veterans Act, which was done last year, and I briefed that on what that was all about. That took effect January of this year as far as deciding claims. In short, what it means is that Blue Water Navy veterans that served during the Vietnam era, they're no longer treated any differently than a boots-on-the-ground veteran that may have served in the Army or the Marine Corps on the ground. Any veteran, whether offshore within 12 miles, any veteran on inland waterways, which they call brown water Navy veterans, or any veteran on the ground, are all treated the same in terms of VA disability compensation. So no longer the way it was in the past, if you were a Navy veteran serving offshore, you were not eligible for presumptive diseases as associated to Agent Orange, and now they are. So it's a huge landmark change within the VA, and I've had several Navy veterans on tap that claims were denied, and then as of the law passing last year and as of January started redoing those claims, and they've been decided in their favor. So that's the reason for the increase for the 407,000. I've got a lot of claims back in favor of the veteran for big money. So that's probably the biggest thing for this year, is that Blue Water Navy Veterans Act. The second thing there, basically, in short, what that is there are survivor benefits for certain eligible survivors of veterans that pass away. And right now, it's a flat rate of $13.50 a month for a veteran that may have been in receipt of disability compensation when they pass. That would make a surviving spouse eligible for benefits. DIC is called Dependents Indemnity. It stands for Dependents Indemnity Compensation. And right now, it's a flat rate of $13.50 a month for that surviving spouse. They're trying to get it changed and put it in line with what the military service branches do, which is 55% of a veteran that is 100% permanent in total. A veteran that is 100% permanent and totally disabled through VA purposes is about $3,000 per month in disability compensation, and 55% of it is $1,650. So right now they're fighting to get the VA's rate to change to make it equal to what the military does. And that right now sits around $1,650. And that right now is trying to go through the House and do the Senate and all that good stuff, and hopefully they can get that changed to be more money for a surviving spouse. And the last one there is the Veterans Residential Choice Act, HR 4985. That basically, we have what's in place with the VA right now for local nursing homes. The VA is very picky about where their veterans go in terms of the quality and the capabilities of nursing homes. We only have 2 nursing homes in the area, Sunset Nursing Home and Carthage, that have been approved by the VA for certain veterans to be residents there, and the VA pays the bill, basically. So this Veterans Residential Care Choice Act is trying to open that up to more veterans to be eligible to stay in more nursing homes in the area if VA approved, and the VA will pay the bill. So basically, in short, it's going to open it up to more areas in nursing homes, assisted living facilities, where the VA will pay the whole bill for the veteran to stay there. That's basically, in short, what it is. Right now, we only have 2, Sunset, like I said, in Carthage, where if a veteran's admitted and they're eligible, they qualify, the VA will basically foot the bill for them. They're going to open that up to more nursing homes and more assisted living facilities in the area, hopefully, if this passes.
So what's the other one? You said there's 2, Sunset and which?
Carthage, skilled nursing facility.
Sunset.
And so those are probably, as of right now, the 3 biggest highlights with the VA amidst everything going on with the pandemic. They have also been at minimum staff, so things have been moving kind of slow, but they're moving, and they're slowly starting to phase everything back in, like a lot of things are. So things are picking up a little bit. But basically, business has kind of been same pace. That's all I got.
Any other questions for Steve? Thank you very much, Steve.
Thank you.
Yes, we move to the docket at this point.
Well, we left some time for you because if anybody had questions or anything with the project, because we're trying to talk about that every month as we move forward. So Jerry's here in the other room for anybody who wants to meet with him and talk about it.
So there were some questions, I think, that I know I had for Jerry, so I guess I'll make them.
Well, let's get him to, that's why he's here, so let's bring him back in. We need to talk to Jerry.
Okay.
That's all I have to say.
Well, that's kind of what I think would be appropriate. And so we've got a little thing in here regarding
Jerry's got it here.
these late resolutions that Dick put in, are they going to go through this committee or a separate committee?
This
They're going to go through this committee. So I have questions. Definitely. Gary? Okay. Someone else have other questions? Jerry's in here now in regards to the hospital project. Okay. Then I guess I will have one question with regards to the overall cost of the project. It seems to be going up on a regular basis. Is that just because of add-ons, or, I mean, we're up to, I thought we were well below 30 million when we started.
Can I see it?
Sure, absolutely.
So when we first started,
So there are some calculators you can use when you're doing new construction and rehabilitation of healthcare facilities in different states and different regions of the state. So based on square footage, you then work that calculation. So that calculation brought us to about $25 million, okay? So then we begin the design process. The one fundamental change has been the addition of, let me back up. The initial plan that I showed you back probably about a year ago, we had the surgical pavilion, which is its own tower, if you will, that's physically connected to the existing hospital. The ground level or first floor was not built out, it was just a shell. As we went through the design process, through that process, there was a conversation, what if we relocate our specialty practices, the surgical practices, to the ground level, which is right below where the ORs are going to be. Okay, so when you enter that building, you will have a choice of going into where the surgeries are or going down one flight and where the specialty practices are. So we worked out some pricing to try to understand, is this the time to do it or do we put it off into the future? So we had some motivations. When you're not in existing space, that's the best time to build it out. The cost to borrow money is as low as it's probably been in our lifetime. We are working hard to maintain a strong surgical presence. So when we put all of that together, we decided let's add it to the project now. The budget I shared with you, I think it was last month, it was, I believe, around 32.4, and that included that project. The groundwork, we underestimated in the preliminary budget the cost of that. There's a lot of rock that has to be removed to put the surgical pavilion in. There are some trees and there's this big hill behind the hospital. Most of that is rock. So we have to remove that, and we're increasing parking. Okay, so those are essentially the big drivers. There is some inflation for the equipment that we'll be installing, and that's basically putting in the 4 operating rooms. So we're in from that first budget to the budget you saw last week. The principal driver, however, is building out that floor to relocate the practices, and that's the same floor where we're going to have the new morgue, and we've increased the number of people we can serve in the new morgue. We're going from 2 to 5. So that's probably the principal change, maybe.
Okay. Now that estimate does include a project manager for this project?
Yes, John, your former colleague, John Lehman, is on the hospital board. John sits on the planning, building and grounds committee. And he's sort of been a bit of a dog on a bone on this one to make sure that we don't lose track of this. And so we sent out an RFI to 14 individuals and companies that do this sort of work, and we had responses from 4 of them. And at next month's committee meeting, the committee will review the 4 proposals. All 4 have experience building large hospital projects. So that is built into the budget that you are seeing.
Okay.
Yep. Okay.
I think another driver of the final number was that when we first started talking about what we were going to bond, the hospital had committed $5 million of its own fund balance. With interest rates as good as they are right now, the hospital has decided that they'd rather bond the full amount rather than putting $5 million down, because you can borrow for such a low rate, it doesn't make sense to deplete your cash reserve. So that might be a difference between what we originally talked about for the bond, and now it's all the way, you know what I mean? We might have said 28, and now it's 33, so that's part of it too.
Yeah, actually, that's a good point. I kind of just don't think about that one because it's not part of the building. But I can't tell you today what we're earning on the money that we've invested. But we are doing better than 2%, which is what the number would be. So,
Well, that, you just answered what I was gonna ask. I was wondering what the bond rate was. But I was also wondering, the estimates that you have, are they
On the construction part of it, are they supplied by BCA?
it's a combination. It's BCA, it's their vendors, and the engineers that they work with. There are some things that are very specific. So when you outfit an emergency, an operating room, like we know the cost of the overhead lights and the tables and the monitors. So those are pretty good. I think the one number that is going to be a challenge for us will be the cost of steel and the cost of actually building the project, the labor. And so the timing of when the bid goes out will greatly influence it.
Yes.
If we're very early in the season, like sometime next winter,
Right.
we'll be in the front of the line. I think if we're not resolved on that point, say till June, that is just not a good time to go out to bid on this project. I mean, you guys know that, but so that would have some influence. I've already met with my team, several times, and there's always tension when you build projects like this to stay within a framework of a budget. And just this morning, I said, folks, we are not bringing a proposal that's greater than $33 million. So there'll be no end runs or any of that sort of thing. And if the bids come in a bit higher, then we have to figure out how to make it work for the 33.
Well, no offense, but the 33 scares the dickens out of me. Say nothing about more.
I appreciate that, and in my hospital world and in my experience, this isn't meant to try to make you feel better. This is not a grand project in the healthcare world. For Lewis County General Hospital, it is a grand project. I would view it as one of those generational projects. Okay. So I fully understand that point of view. But we've had some encouraging news on the critical access designation, and Representative Stefanik has done a lot of work on our behalf. I've heard from CMS Region 1 Medicare. We're still not a close topic, but we're getting closer to it. And all the signals are we will get over that hurdle.
And that helps to know that could happen with the stability of it,
Right.
and not the wondering.
It's an important part of how we are paying for the project. So it is a crucial point. And without that, I was just telling Mr. King that if in December we were told we are losing critical access, the project stops, because we have to step back and rework the plan, because that's an important part of how we are financing and paying for this thing.
Glad to hear you say that.
Yep. Good?
Good, thank you, Jerry.
You're welcome.
Anybody else have any questions for Jerry? Okay. I guess we can move to the dockets.
The first one is a resolution authorizing an agreement between the County of Lewis and New York State Office for the Aging to accept the ADRC-COVID-19 grant award in the amount of $23,609 and to appropriate these funds.
Do you have any questions? All in favor? Aye. Opposed? Carried.
Resolution to amend the compensation plan with reference to the Public Health Department to abolish a permanent part-time administrative assistant at a salary grade 15 and create a permanent full-time administrative assistant at a salary grade 15.
Elaboration on that, please.
Yep. So what we're doing here is we have an administrative assistant who has resigned. That position was working 28 hours a week. They were already eligible for vacation, holidays, benefits, etc. We're bumping that up to 35 hours a week. So basically they're at 4 days a week. We're bringing in 5 days a week. And really the only difference is the salary, since they're already eligible for benefits. But that should, especially right now, we're in a situation where we need people to assist. In the long run, I've talked to Ashley, because my view is if we create a position now, you don't create it for now, you create it for the next 35 years, because you might get somebody that will stay for 35 years. And Ashley feels that the number of programs that public health manages and that caseload continues to grow on all fronts. The amount of pre-K, caseload continues to grow. Our immunization programs continue to grow. So we do feel that we can justify the additional 7 hours for this person. Ashley, is there anything else to add?
No, not unless there's specific questions.
So it really wasn't a part-time position.
It was
Just
20
so we're
hours.
part-time.
It's the classification of the treasurer's department, the way we do it. Because it wasn't, if you're not full-time, you're part-time.
Right, so if it's less than 30 hours, you're considered part-time, but a permanent part-time individual is someone who works on a set schedule, and this individual worked 4 days, so 28 hours, because they were
Got it.
7-hour days. So they were eligible for benefits.
So it should be if you're eligible.
There are reduced part-time benefits as far as how, vacation and stuff, but yes, they were eligible for benefits.
So you talked about a pre-K program, is that what you said?
One of the programs we have, yeah.
So are our schools doing pre-K this year?
We
Or do we still do this program?
We are responsible for pre-K for the students' education until they get into kindergarten. The county is.
Right, so it's, I'm sorry to interrupt, but it's not necessarily the schools that do the preschool services. There are agencies that we contract with
right.
that provide those services. Much of them are happening via telehealth services at this point. Back in mid-June, the state did allow for in-person services to resume, with telehealth being still the preferred method. Some of our agencies have their plans for, in the event that in-person services is preferred by both the family and the therapist.
Thank you. Sounds good.
Any further questions? All in favor, say aye. Opposed? Carried.
Resolution to amend the compensation plan with reference to the Public Health Department to create a permanent full-time public health nurse at a salary grade 35.
I can elaborate.
Please do.
We received CARES Act funding specifically for the Public Health Department. It has to be used on personnel during the pandemic. We have a nurse who is planning on retiring at the end of 2021. So this will work out well because we'll use the pandemic money to hire an additional nurse to get us through the next year. And then when our current nurse retires, this new person will take their spot. So we're not essentially adding anything to the Public Health Department. We're just expanding using the CARES Act for the next year. And then we'll go back to our...
It's a temporary one-year expansion per se.
Yep.
Okay. Thank you. Any more questions? All in favor, say aye. Opposed? Carried.
Resolution authorizing agreements between Lewis County Public Health and Health Research to accept COVID-19 related grant funds in the amount of $296,318 and to appropriate these funds.
Any questions? All in favor, say aye. Opposed? Carried.
Resolution authorizing a memorandum of understanding between Lewis County Public Health Agency and Community Action Planning Council for the purpose of Lewis County Public Health implementing the council's child care project to provide site visits to child care programs, examine and verify child care staff certificates of training, review, approve, revise, and sign child care programs health care plan, and notify Jefferson Lewis Child Care Project if health care plan is revoked for the term of October 1st, 2020 through September 30th, 2021 at a rate of $40 per unit of service.
Have any questions?
Renewal?
It is a contract renewal, yes. And we are receiving that money for providing that service.
You knew that was the next question, didn't you?
I thought it might be.
Okay, thank you. Any further questions? All in favor, say aye. Opposed? Carried.
Resolution authorizing a renewal agreement with ICU Security and Private Investigations for armed security guard services for the DSS building located on Outer Stowe Street at a cost not to exceed $82,836.75 for the term commencing November 1st, 2020 through October 31st, 2021, with the local county share being 25%.
Is this, how much of an increase?
No increase, it's the same rate as last year.
82,000. We approved 82,800 last year. That's, why couldn't we hire a sheriff's deputy? Put a sheriff's deputy in. No, it'd be less than that.
The
Correct.
cost of a brand new full-time sheriff's deputy is $87,000. I just had my budget meeting with sheriff. That's why.
Worked on our calls, we utilize them on weekends.
Probably utilize them on weekends if they're
I
working.
work them overtime. Yeah. I just find this to be outrageous amount of money. What the guy does.
Well,
Stands there with a wand.
we're only, you only pay 25%.
Still, it's 25% of our tax paying public paying for that. And I just find it to be totally wrong. The sheriff's department sitting within 500 feet of the building. There hasn't been an incident in 30 plus years.
That's incorrect, Mr. Coulter.
Yeah, you could handle it with the sheriff's department right next door.
Yeah, but
It's a button.
they're always at beaches.
Yeah.
Drive through it.
Ouch, ouch, ouch.
Ouch.
Let's get back on track. So, any further discussion? Now, Jenny had a comment regarding an
We've
incident.
had to use our security in the last couple of days. We send those incident reports to Joan. We've had to remove people from the building in the last week who have become irate, out of control, swearing, spitting at us. So yes, they have been invaluable to us for our safety.
Okay, thank you, Jenny. Any further discussion? All in favor, say aye. Aye. Opposed? Carried.
Resolution to appropriate funds in the amount of $22,148.44 for program year 2020 for the period of July 1st, 2020 through June 30th, 2022 for the adult and dislocated worker programs per the notice of obligational authority dated July 22nd, 2020 through the New York State Department of Labor.
Any discussion?
That doesn't seem like too much money. Can you tell us about this?
So this is one of several payments that'll come for adult and dislocated worker payments.
Oh.
It kind of streams in quarterly or semi-annual payment cycles, so this is just one of the payment cycles. And we use this money to pay for like training classes and work experience program, on-the-job training locations for people.
Thank you. Any further discussion? All in favor, say aye. Opposed? Carried.
Resolution to amend the compensation plan with reference to Lewis County General Hospital to abolish one full-time health management transcriptionist and one part-time health information management clerk, and to create one part-time patient access clerk, one full-time patient account clerk, one full-time health information coder, and one full-time health information clerk.
Anybody elaborate on this, please?
First question?
Just
Why
one
did you
explanation, please.
For the coder, we had the transcriptionist in there that started in 2007. She has furthered her education and is now classified as a coder, from a transcriptionist to a coder. She's worked in that capacity for several years in a secondary job code. So this is kind of cleaning up and making what's been happening according to contract and have her in the right position to be paid. The Meditech expands overflows to dramatically change the need for transcription and increase the need for a coder. The coder position is very valuable because that's how we make our money and how you code all the different stuff. The budget will not be affected as she's been paid as a coder for the past several years. The clerk, part-time employee, worked additional hours for HIM, Jerry.
Correct.
Health Information Management.
Yes.
During computer conversion upgrade and not using casual staff anymore. What we're trying to do there, we have a lot of casual people retired that go back and say, hey, I want to be a casual worker. They may only work 5 hours a year or something like that. So we're trying to clean up the casual amount of people. You call them to work, it's not convenient for them that they see don't have it. So this gives us a little more direct flow into how that works. We won't replace or use casual staff members in the future. The budget impact will only include personal leave time and holiday pay as a minimum budget. The access clerk in the rehab department, we use casual staff to fulfill the needs in that department. This position requires 45 to 50 hours per pay period and should reflect a part-time position. There are approximately 12 providers in the rehab area. The need for additional clerical assistance in the department and the correct classification for the position. The budget did include the hours in the budget. The benefits would be on the calculation. Patient account clerk, we transitioned away from cops, and Jerry, you gotta help me with cops. That's an outside agency that
clinical billing company
Yeah.
out of Syracuse.
By doing that and adding this one position, our savings is $20,000 a month. Plus, we're now making less mistakes, we have better quality, and we have a reduction in our bad debt write-offs. Due to the increased workload and additional staff members needed to keep up with the workload and work the transition, the remaining 3 clinics get in-house units, which would take that $20,000 a year and increase it exponentially. That's it.
Thank you. So our
The minimum budget impacts on that.
there's a minimal budget
Changing
impact.
around staff and putting them to work where they need.
Anybody else have any further questions? Further discussion? All in favor, say aye. Aye. Opposed? Carried.
Resolution to reappoint members to the Board of Managers of Lewis County General Hospital commencing January 1st, 2021 and expiring December 31st, 2025.
Discussion?
These are 3 board members who served the board very well over the last 5-6 years. They're current board members who have asked to be reappointed. The committee that oversees this HR looked at it yesterday and approved it to send it to our board next month. We're just trying to allow these folks to to understand that they will be reappointed. When we're doing the budget talks and what have you, they know they're gonna be a piece of it to participate effectively in that. In the past, when we've gone out and advertised, we really had to make phone calls and knock on doors to get anybody to even send a letter, right, interested in serving on the hospital. There's just not a big crowd of people out there. We've had people who said, yeah, we're interested. And so you put them in the interview process, they don't even show up for the interview. So we've got 3 people that we really know their characteristics and what they can do for the hospital and what they have done. So that's why we're recommending reappointment.
Okay. Well, it's procedurally fine. I have no problems with it. Any other questions? All in favor, say aye. Aye. Opposed? Carried.
That is all I have for dockets.
Anybody else have any questions for Health and Human Services Committee? Now that Jenny's here, I've got a couple of quick questions, Jenny, please, based on your report. HEAP applications for July, we had 30 HEAP applications.
Right, so HEAP remained open due to the COVID pandemic, so people can still apply to get fuel for heat. But also HEAP covers air conditioners for those that have a medical condition, and HEAP covers furnace repairs and replacements. And of course, we push that during the warm weather months, so you're not without heat in the winter and you're more efficient in your fuel. So that's where that's kind of going right now.
Okay, all right, thank you. And then I was noting the, just a quick update on the SNAP.
Yes.
Is that exorbitantly higher than it normally is because of COVID?
Yes. So we were averaging somewhere about $290,000 a month in SNAP benefits going out per month in Lewis County. As you can see, in May, it was $520,000 worth of SNAP benefits. That's to Lewis County residents only. And in July, $451,000. So a couple things have happened because so many people are unemployed and out of work. One, when schools closed down, SNAP extended an extra benefit to households on SNAP whose kids received free and reduced lunch. So even though schools were obligated to deliver lunch and breakfast to students after schools closed down, the feds allowed a supplement to that. So those supplements have been flowing in pieces to SNAP recipients, and then the last group to receive this will be people that get free and reduced lunch or breakfast at school, but do not receive SNAP benefits at all. They're going to receive a debit card in the mail with a benefit on it to buy food because kids are home so much more. So if you think about South Lewis School District, their entire district qualifies for free and reduced lunch due to the high poverty rate in South Lewis School. So every parent in that district will receive a supplement related to that. And SNAP also has increased for several months the allotment given to people for a benefit, bringing them up to what we call the household maximum. So we quite often hear from our seniors in the county, they get a minimal benefit because they have a Social Security and maybe a pension income. So they might receive $16 a month. That benefit was increased to $194 for a single individual. And that commenced in April, May, June, July, and August. And I would suspect that would continue while the state of emergency is declared. So we've had an increase in SNAP applications now. I should qualify that. With pandemic unemployment insurance, we had people that became ineligible for SNAP because the unemployment payment was so high, you know, the extra $600 a week. Well, that's ended. So we're receiving in the neighborhood of 15 to 20 applications per day for SNAP right now. So I expect that benefit amount to be higher again here in August and September.
Thank you. So like for South Lewis, there was just a blanket for the whole district. They didn't look at anything on an individual income family basis.
Correct. Because it was the state, we didn't have to do this work locally. The state matched to the state ed department and matched files of families. What we're seeing is people that have moved or have questions, maybe they didn't receive it, and we're forwarding the benefit to the correct addresses if we can locate them. Otherwise it goes back to the state. But it has to do with that district having so many students that receive free and reduced lunch.
Okay. Thank you. Any more questions for the department heads we have here?
Crystal is outside.
Okay.
Yeah. Could I ask about congregate meals?
You can, but I haven't talked to Crystal since yesterday. Sorry. So Phil was wondering when we'll start up our congregate meals again. Great question. I need to talk to Crystal and Ashley about it. We haven't had that discussion yet. But the only difference, I would suppose, between schools being open, I mean, now gyms and theaters can open. You know, the only difference is the seniors are more of an at-risk population, so we've got to think about that from a public health perspective and make sure we understand all the risks. But yeah, we'll have to get back to you on that one.
And last I talked with Crystal, she was actually gauging their interest too, to see if they, you know, what percentage of them were interested in coming back to the congregate meal sites. You know, if there's very few of them, then does it make sense to open them back up versus continuing them undelivered? I don't know what the outcome of that was.
Gym reopens and they're forcing them to put new ventilation system or add-ons to ventilation. I wonder what they would do that with the congregate meal sites.
I don't know if other counties have started theirs back up again, so we've got to get into this and see where we're at.
As far as that, speaking of the gyms, is, you know, I already know the answer to this, but I want to ask it. Who is policing the gyms? Is that state public health or county public health?
That is a question that the New York State Association of County Health Officials has brought back to the state. We are a partial service health department. We don't typically do inspections, but it's looking like it's going to be the local health department, not a regional. So we're looking for more guidance as to what those inspections should look like, what we're supposed to look at when we go inspect the filtration system.
Sure. So it's just the typical non-guidance from New York State is what it boils down to.
As a regional.
Yeah, just throw it out there and then hope people can just abide by absolutely no idea what the heck we're talking about. So, okay. And again, I don't mean to put you on the spot, Ashley. It's just you're that department head. So.
We will be fully educated before we go in to do an inspection.
All right,
if
very
it
good.
does fall to us.
Just for information, on the 2 o'clock call this afternoon in our region, there was major pushback from that from all the counties.
Okay.
Suggesting that the Department of Health, who is in Watertown, has the staff and the ability to do that. Why isn't this DOH doing the checks instead of a local public health that's already overstressed?
Oh, on the gyms?
Yes.
Because I mean, have you heard anything about the ventilation system actually? Are they requiring them to put like UV lights in along with the HEPA filters?
As far as I know, it's just the MER 13 filter that needs to be installed.
But this is the part that makes no sense. If you could get a certified HVAC guy to say that your system cannot be retrofitted for these filters, then you can be exempt from installing it. So
Everybody has that guy.
that's there's an issue there.
I've got a friend.
Everybody's got that guy.
But if you are willing to do, you can do it and you're willing to do it, 5 weeks out before you can get it, can you open now and install it in 5 weeks? No.
So it's yes, you can, but no, you can't. That's what it boils
That's
down to.
the state.
Yep, it is. Okay.
I don't know if the state health department has enough people out of Washington, that they were have a huge workforce up there.
Well, the message was basically, stop sending unfunded mandates down the pipe. I'm sure it'll fall like that.
Exactly.
Well, if it'll help get our businesses open, I'm sure we'll find a way to
At least we're on
Train,
the path going forward. Right.
train Ashley on basic HVAC inspection.
I'm always willing to learn something new.
We'll send her team crawling around the ducts and figure it out.
There you go. Okay. All right, very good, thank you. Any more questions or discussion for the good of the Health and Human Services Committee? If not, can I ask for an adjournment, please? Mr. Chartrand, second. Mr. Hathaway, we stand adjourned.